And Dr. Tanya Altmann is the editor of the American Academy of Pediatrics book on child development, The Wonder Years. Dr. Altmann, good morning to you. Pretty controversial topic here. This notion that you can train an infant to use the potty, they call it elimination communication, and the people who do it swear by it. Do you think it works?
Well, for some families, it can work. It is a commitment, though, and my concern is that for some already overly exhausted new parents, such as myself, this may be one extra responsibility that might push them over the edge.
But do parents, I mean, do babies have an instinctive ability to let a parent know, to signal to a parent when they want to go to the bathroom, when they need to go to the bathroom?
Well, babies do communicate. They laugh, they smile. So parents who practice elimination communication, they study their infant's language. And when their baby makes that face, like the one where they're about to start pushing, they will take and rush them to the potty. Or they'll notice a predictable pattern, such as after a nap or after a feed. So really, it's the parent that's being trained to recognize their infant's signals. So if the poop gets in the potty, give mom the gold star.
The mother in the setup spot says she feeds her children only natural foods. Now that's wonderful and it sounds great. How hard is it to actually carry out in today's day and age?
Well, I mean, I think it's something that is very important. In fact, in my practice, even before this study came out, I challenge all parents of infants and toddlers to not introduce fruit juices to their child's diet. Get them used to drinking water as their beverage of choice as an infant. And years later, most of these parents come back and they thank me and they say, you know, making healthy food choices for our infants and toddlers really helped dictate the foods that they were going to eat later on in life.
So in other words, and if a parent says, look, my child, my daughter, my son likes the taste of apple juice, well then give your child an apple. Don't give them the little juice box that might contain these additives.
Exactly. Fresh fruits and vegetables are always a better option.
There was some concern in an article that I read about this, that if you do this to your children, it sounds like you're punishing your children, but if you do this to your children, there'll be a social impact on them because their friends are drinking the juice box. How do you feel about that?
Well, as a parent, there are always going to be things that your children want to do that aren't going to be healthy or good for them. And as a parent, it's your responsibility to set limits.
Somebody comes into your practice and says, I don't want it for my kids. What do you say to them?
Well, informed consent is one thing. However, what I see is that many parents are getting misinformation out there. There's so much misinformation, especially on the internet. And I find that when parents are truly educated as to the benefits of vaccines, they do choose to protect their children and those in their community. Parents today are extremely lucky because many of them haven't had to stay up all night in the intensive care unit watching their child gasp for breath because of whooping cough, or worry that when their child had a high fever in the emergency room, they might die the next day from meningitis. Vaccines save lives, and they're doing a great job.
Let's go right to the frequency question. A lot of people say, yes, you give a baby, a toddler, a little child a bath every single day, no exceptions, and you say?
Contrary to popular belief, kids do not need a bath every day. Twice a week is fine for infants, and with toddlers and older children, 3 times a week or every other day is usually enough.
Even though with infants they're wearing diapers, and although you do your best with a sanitary wipe to clean them when you're changing the diapers, still you don't think every day you need to kind of make sure they're clean top to bottom?
Well, if they're visibly dirty, you can focus on those problem areas such as the skin fold. So for those drooling infants and toddlers, that would be the neck, underarms for older children, and the diaper area. Otherwise, on the nights when you don't give a bath, simply wash their hands and face.
And if your children are in daycare, they're around other kids, they're getting into weird things all the time, still for a toddler or young child, 3-4 times a week is okay.
If your child comes home from daycare covered in dirt or finger paint, then yes, they might need a daily bath. But bathing them every day will not decrease their risk of infection or cut down on those coughs and colds this winter.
Now, when you do bathe a toddler or a baby or a young child, soaps, shampoos, conditioners, what's your opinion on those things?
I like to use a tiny amount of a mild scent-free soap and focus on those problem areas as we discussed. But most importantly, since water can be very drying to infants and children with sensitive skin, right when they get out of the bathtub, pat the skin, leave a little bit of water, and then smear a thick cream or ointment all over them to help lock in the moisture.
Jessica Weiner and Dr. Tanya Altmann are with me right now, and we have a bunch of questions that we want to ask about the over-sexualization of children. And I want to go back to the precocious puberty with you, because I have heard this. I've heard this from actually a woman that has a doctorate in nursing. We call her Dr. Nurse, and she thinks that precocious puberty is because of the meat, the hormones in the meat. Is that true?
Actually, studies have shown that hormones and pesticides in meat, while probably not a good thing, have no effect on the age that girls go through puberty.
Oh,
and there have been many studies done that have shown that the average age that women go through puberty really hasn't changed much since the 1950s.
My baby has a cold and now she's out of breath and wheezing. Is that normal?
Trouble breathing and wheezing is never normal, and that's a sign that you should immediately call your pediatrician and take your child in for a visit. Now, the common cold, kids can get a cold every couple weeks during the winter. They can get up to 11 a year. So during the summer, they're pretty healthy. So during the winter, every 2 to 3 weeks, children that are in daycare or infants who have older siblings that are in school will get sick. And you don't always need to call for every cold, but if there are ever signs of trouble breathing or wheezing, then that's a sign to call your physician.
Okay, thank you so much. We really appreciate you being with us today.